that's where I want to begin from. The government has done some work, and from where I visited, I commend them. The trouble, this government with the money, because in terms of advocacy, they have really done very well, helped by the second wave that made everybody know that COVID is a reality. You can lose people, you suffer. In between, even what they should have considered, they wanted to continue presenting themselves as angels, that everything is okay. We are better than, you saw the president one time saying they are better than even first world countries, the achievement. So because at the beginning, you are looking at three things at the beginning of this whole pandemic. First, how do we stop the spread? That worked for some time. You remember when they were chasing people as if they were chasing criminals. Police vans, chasing truck drivers, they are in Wero with the cameras. That chapter of stopping the spread ended. And I think I give them credit, they did very well. The second chapter was the preparation for the real outbreak. And that I pass by Nambole almost every day. We lost a person in Wego, one of the senior people there. So he walks to Nambole, says, I want to be admitted, I'm not feeling well. They say, no, for you go home, you can take care of yourself. But up to date, I don't know what Nambole is or was offering. At one time, they were using it as an isolation center. At another time, it's supposed to be a treatment center if your case is not severe. So the advocacy give them credit. If they want 100%, please give them. But the real response after the outbreak, I don't know, Oscar, you were a teacher. I don't know if they deserve 20, because everything is in a mess. The Auditor General's report is pointing at from the first distribution of food. And even the real distribution of food, because you see, in this government, every crisis is an enterprise. And they like getting money, because in Parliament, you're all going to be bulldozed. If you sit down, you see we are in trouble as a country. So even the little that they have done is going to be masked by their appetite for money and misuse of public resources. Because there are cases into COVID-related activities, surveillance, security, communication, this and that. So the real fight against the outbreak of COVID, it appears to me the expenditure there is not more than 10%. Money went into, so you have a wedding and the Bazinyi, there is no money on Mugore, so the money is on Bazinyi and security. And balloons. So this probably are a problem. First, you are still in a pandemic. They will keep telling you you are demoralizing power doing this, but also they are blackmailing you. You must appreciate government has done. The other day I told the MP in Parliament who had brought what was supposed to be a motion that MPs should surrender each one of us 2 million shillings per month. And of course he didn't know how to do this. Things are done in Parliament. But when I asked, so then people were very angry with me because I had said somebody has not done well. But they were the ones now saying things are not good, we should surrender. But I say now, it can't be both. If he has done very well, we should be thanking him, clapping, but we shouldn't be fundraising. The reason that you're inviting us to fundraise means things are not okay and someone responsible has not done his part. From Chogam to, because Chogam, you remember there was a committee chaired by Kenya. All the procurement regulations were supposed to be waived because Chogam is here, the whole world, it was a crisis, the whole country is going to benefit. Now if you grow up, you wait by the roadside, the guests are coming, you're going to become rich. I went to meet Kasiri Gwanga. He called him Verare at that much in the house, and he told me these people are very bad. And when I say these people, later I will explain who. He said, you see, even simple things like planting grass, they have refused. I went to Nasasira, he says, you go to Hope Mwesige, it is them in the money. They can't even allow me to plant grass, me Kasiri Gwanga. So that crisis of Chogam and hosting Chogam was supposed to benefit them. Another opportunity has come. Chogam became an enterprise, the one who is supposed to supply, because in the reports you saw Tesa's daughter, the others will know later. Them, once a crisis of this magnitude has hit the country, I think they even go to the church to thank the Almighty. Please, thank you for bringing this an opportunity. Because if you did this budget, 800 billion shilling, logistics, and the real money for COVID
is 2 billion, nothing. You know, when Semuju says these names, it puts me in real trouble.
No,
I'm just thinking of the people who are going to call me after the show.
I am telling you, that's what Kasiri Gwanga told me.
Now, as Semuju says, the COVID money is 2 billion. The other money is...
I am not the one who saying this is the report.
Pointing out, sorry, as Semuju has pointed out from a report. The report itself says, stop stimulus needs forensic audit. And then the report says vaccines. And as Abdul, chair of the committee, has said, that there's no movement on that as yet. It is now fact.
It is now fact, and schools are still closed with no end in sight.
The president actually this week said, no, it's saving lives, so schools will not open. But there's no procurement.
Until they vaccinated everyone below, above the age of 12. 60%.
No, until they vaccinated teachers and support staff and everything.
No, he said the
children,
even the
12
children,
to 18 years. 12 to 18 years have to be vaccinated as well before schools can start. And it makes sense.
There's a scientist that told him that?
I think he's a scientist in a way. He's everything. So.
And you see,
so I'm not surprised that he's masquerading as a scientist when COVID.
That is the second wave. By the close of this year, we could have a third wave.
I know.
And the parameters would certainly be different. I made a joke that now we are faced with the Delta variant. And I've baptized the other coming with the Opondo variants.
So, yes,
now, because there is the Delta Plus, which is more severe, more aggressive, and spreads more faster. There's a Lambda Plus, which doesn't even respond to the current vaccines that we have. So we have to prepare for this, because at the end of the first wave, everyone applauded us for doing relatively well, but I insist it was also because of certain circumstances that favored us, a young population closing down early, etc. That said, we did not even take one lesson from that. And for me, the tragedy is the third wave is going to come, and we've taken no lessons. And there is plenty of COVID lessons to take internationally and locally. Because when we saw what was happening in Italy, in New York, in all these countries, and these are the first world countries, if you see your boss struggling, you, a housemaid or the shamba boy, you have to realize that the situation is bad. You have to take some lessons from those situations, and yet we continue not to take lessons. But I'd like to point out, reading the report, I realized again, it goes down to systemic problems that we had at the Ministry of Health and generally in the health sector in this country. And these are compounded by the fact that we are now having a pandemic. Because when you look at these teams, the COVID task force teams, and then the MP teams who went out into the field to try and gather information about the situation on the ground, most of the issues we had existed long before COVID. And if disease finds your body weak, you haven't been feeding well, you haven't been doing exercise, you haven't been generally looking after your body, and then you get HIV, you're going to fare worse than the person who was doing better. So we are suffering from the general problems that we had. Dr. Anthony Mbonye, the late, who passed on, I think, last month, wrote a book about what is going on in the Ministry of Health. And I think Parliament should read this book, the president should read this book, and everyone involved should read this book before you get to the understanding of the situation. If you don't read that book, maybe some of it was driven by anger, but take away the salient features of this book, which clearly point to the fact that there is rot in the Ministry of Health. So if you start getting money and throwing it at the rot that is the Ministry of Health, you are not going to get anything better, be it in the first COVID wave, the second or the third. So let's stop deluding ourselves. Let's stop, because even the whole exercise of MPs going into the field to find out that as per what is on the ground cost us how much?
No, actually, you see what is happening. For example, we move in a parliamentary bus.
Be that as it may, we
hold
didn't
on.
spend money
I
on
can,
that.
yeah, of course, you would spend some.
Yeah, that's what I'm saying. That's what I'm saying. I'm not criticizing the expenditure.
No, I want to give you.
I'm just saying that.
No, let me give you the
Yeah.
name. Because you see, for us, we are paid 400. How much is it now?
Did you give per diem to the MPs?
Which one?
They give you money for hotel.
For hotel, exactly.
Yes.
So what I'm saying, we have to
There
give
is
money
no
for hotel
allowances
and okay.
for
But whatever expenditure we spent on that, we wouldn't have spent it had we not gotten ourselves in this situation. Like they say, prevention is better than cure. If you prevent something from happening in the first place. So unless government sits down with itself and stops making money off every tragedy that befalls this country, like Semuju was saying.
Now what you're saying is because of all the challenges, the bungling, then there's a need for a task
There
force.
is a need to spend more
And the
money.
task
It's like
force
that
is
child
going
whose
for
parent
another
doesn't have
investigation.
fees,
And the
but they
task
have to
force calls
yes.
for another investigation.
It's investigation, and that costs us more money. So Omavu kind of thing. Like we don't do us any favors if we don't improve on the way we operate right from the start, because the next crisis that is coming is in the education sector, but that has found the education sector also floundering. And show me a sector in Uganda right now that is not floundering, be it agriculture, education, or health. So health has had its own illnesses, and they all come from the politics that is the Ministry of Health. And that is why you see NMS is supposed to be procuring vaccines, but they are busy bickering with the minister, and then the minister is bickering with the PS, and all through that there are always those looters, and these are the same names, because exactly the bottom line is money for the same greedy people who have been greedy for the last 35 years. And I don't know how these people never get satisfied, because in the end, let me tell you, the tragedy is that their fellow I think they should learn from this, because their own families, they've lost people because of due to lack of oxygen and due to the systematic failures that they've created themselves. The tragedy is that they don't even realize that your patient, because I know someone whose relative, and they're in government, and it's one of those families that has been looting for many years, and one of their relatives died in an ambulance outside Mulago. And I thought to myself, maybe they should take lessons from this, because at the end of the day, they have no country to fly to now during lockdown or during this pandemic. Because we are on the red alert, half of the time you cannot fly your patients abroad. And now, when I saw this gentleman from Kaki Investments, Tom Kigonya, he's been one of the ardent NRM supporters, and yet he lost his life during the pandemic. And part of the reason people are losing their lives is because of the poor performance of government. And this is government they've been supporting for so many years. So when I see people like Moses losing people as well as me losing people, then I think we need to sit back and stop thinking that this is another person's problem. So every time you're greedy, because the whole oxygen problem in Mulago was there before the pandemic. This was a 2019 issue when, I think the oxygen was supposed to be procured by people from the first family who got a contract, were paid 6 billion, and this oxygen didn't come. So what do you expect when the pandemic arrives? That whole problem is going to be worse. And why? Because it's
more phone calls
daughter.
to me after the show.
Why?
No, they shouldn't actually call you. They should look into themselves if they were realistic. Because I am so sure Kutes has also lost some people during this pandemic. Maybe his grandfather
Even more
in
phone
the
calls.
village who doesn't. So for me, let's stop passing off
How are these
problems
facts?
as emergency problems, when the truth is that these problems are festering problems in our government, in our communities, in our society. For example, health center most of them didn't even have oxygen cylinders. And yet the money that could buy oxygen cylinders is now facilitating MPs to investigate why there are no oxygen cylinders. Do you see how stupid that is? So at the end of the day, let's stop pretending that these problems have just arrived at our doorstep in the last 2-3 years. These problems have been festering, and if you don't improve, more people will die in the third wave, in the fourth wave, and by the time the worst of the COVID pandemic comes to our door, it's even, because look at the vaccination issue. Even now, Moses, tell us, where are we vis-a-vis vaccination? Who is handling it? Do we have a specific person? Because when you say we can get from COVAX, we can get from donations, the EU, most of the countries discontinues AstraZeneca as a vaccine. And yet, we should, we as a third world country,
I have given
exactly.
the one response.
We as a third world countries should have been at the EU's door asking for these vaccines the moment most of these countries, because we got the donations from the Netherlands and from France because of their discontinued use of AstraZeneca. But we have to have to know that there's someone who is
that
running.
was before, not at the time of discontinuation.
No,
Yes.
even during the time of discontinuation, they offloaded their vaccines to third world countries. We should have been there. But if we don't have a specific person who is running after this, who is making the decisions whether to get from COVAX or the first world country,
Thank you, Nafi.
then we're not going
Allow
to get-
Moses a word in.
Yeah.
Yes. All these accusations Nafi is saying government is doing poorly, and that's why we're spending more money on poor shoddy work, and you and her, now you're losing relatives, all because government is doing poorly. In a sentence or two, summarizing Nafi.
First of all, summarizing Nafi, because Nafi speaks the way she speaks, and sometimes you have to ignore her. But you see, when she says so and so has lost people, so and so lost people, one of the biggest economy in the world, America, has lost 600,000 people to COVID. There is no Tessa in America who need to buy vaccines. There is no whatever you're talking about, but they have happened. So let us also not mix up issues. I don't see how Tessa is involved in any of the COVID-related issues in Uganda.
The daughters.
And those is children.
Wait. So that notwithstanding, I think the ministry has done well in some aspects, like somebody said. If you look at case management, for instance, at Mulago, the National Referral Hospital, which is the biggest hospital, I had a relative who went there, who was put on oxygen, spent there some days, was discharged. In the memories, the same way, one of the Semiji told us how his mother was admitted in Mulago and discharged. So they have had positives in case management. They have had some. You see, the Mulago Hospital did not lack oxygen at all. The challenge was that the plan of Mulago was to handle a certain number of people. So and all other centers, but the time came when they were overwhelmed, and the overwhelming of ICU cases vis-a-vis the ICU facilities has not been only in Uganda. It has been all over. That's why even in the first world countries where there are no these other issues.
But that was their first wave.
Wait, even the second wave, they have had even today. The other day I was reading, I was watching news in some states in America. You have cases where you just watch news. You only watch your news here. Watch international news, you will see that there are areas where they're being overwhelmed.
Katemba is part of the news.
Fine, but I said
Moses, only have your microphone on, so go
that's what I'm asking.
inform the public.
Also watch international news, not only local news. You will see in some cases where they are getting overwhelmed with the spikes, and they are there. So, yes, we can close the gaps, which the committee has pointed out, but also maybe we wait for the forensic report, because there are areas like here what was mentioning when you talk about like money for the big money, 800 billion was for logistics, and then you don't name break it down. What are these logistics? Then you leave any debate not sure which one what to say.
Yeah, but that's not to us.
Was that done? Was that done or not? But what maybe we need to correct. Abdul says.
Go on, Moses.
Abdul says that 2.something billion was put for vaccines, At the same time, it says through National Medical Stores, $9 million has been spent.
I didn't talk of any 2.5.
2.6.
Yeah, that
for the
is
vaccines,
for the
yes.
research.
That's the allocation for vaccines,
Yeah.
as the cost plan is 2.6 billion.
Yeah, but
The report says, but the overall allocation for vaccines is 366 billion.
Yeah, 366
Right.
billion.
That has
You
not
see-
been spent yet.
Yeah, but you see, we are talking about, I think, two budgets. If I'm able to can correct.
Yes.
Because you're wrong about
combined.
you're wrong about the budget of the last financial year. The 360 billion we're talking about is in the budget
Appropriated.
for this financial year. And also, I would also say that the National Medical Store has already had about 80 plus billion, like about 83 billion
Yes.
ready to buy the vaccines. So it's not a question that the vaccines have been under budgeted. Because the impression also you are creating.
No,
No.
the money should be there in time.
No,
because
no,
you see,
the-
there is a rush.
You know,
All
Yeah.
countries are really
the
waiting.
point I'm
Oh, I see where Moses is
When
going.
Abdu was, and also when Oscar
Yeah.
was talking about
Yes.
2.6 billion, it was like you have given other items so much money,
Yeah.
but where the need is in
Vaccine.
vaccines, have given them less money. The point I'm making is that no, the vaccine item as the budget item has also been given sufficient money.
Later.
The only question is whether later on when if those had given them money, I don't think they would have got them. And
Why we don't have it?
under the circumstances. So there's money for vaccines. So the question is, how far have you gone in procurement? Well, at one stage
But
here,
Moses,
I would
Moses,
recall
just stop here for a second and I put to you. If you say there's money for vaccines and the money for vaccines is 366 billion and there's an overlap of 80 billion, but in this small plan here for resurgence, then you say we'll spend 2.6 billion of that. Really?
I don't understand even the plan because that is what
But there is-
when I work the plan. The point is how much money has been put aside for vaccines.
And the
It
point is no one is spending it.
It is over 2.6 billion. Is that okay?
It is 366 billion.
It's more than
No, actually, no. The money which has been put aside is the money, first of all, with the National Medical Stores, because it is available on call.
That
Even
is-
if they say,
That is 83 billion.
yes, even if they say today, you need to write this check, it is
They will
written.
go.
Then the other money which is also available is the one which we have deposited with the UNICEF
The
at
$9
the African
million.
Union
That's about
for the
30
$90 million.
That's about 30 billion.
Yes, that is the money which is just there on
We
call.
on call, yeah.
You get it? Even the 360 billion is supposed to be part of the our 1 billion loan from
Fine. So anyway, the point I'm making.
Just before I
I
return
wanted-
microphone to you, Moses,
I wanted to
was
correct-
just before I return, I know you want to correct the image that we are not ready. You are in the milk industry. If your machine is broken down over there, and then the manager tells you the money is available, that's the analogy I'd like you to take on.
No, the point here is very clear. You were creating an impression that the government budgets for put so much money in many other items, but the most important one of the vaccine, they put 2.6 billion.
In the resurgence plan.
Whatever it is, I would have told you the money is more than 2.6 billion. The question now is, how do you access the vaccine?
Yes.
Whether it was a resurgence plan, as long as NMS say we have 83 billion here with us, we have already deposited somewhere $9 million, which is about 30 billion. That's about 130 or 120 billion plus.
Moses, you are playing around.
I'm not playing around.
Because we already considered in the budget as 366 billion.
Yeah.
That is there.
Yeah.
But in the
for
emergency
you-
planning, you
for
are going
you-
to spend 2.6 billion.
I don't care how.
But it doesn't even
I
matter.
don't care what is emergency or not emergency.
But it doesn't matter.
How much money is there for vaccines? What is important?
Okay.
Whether
And
for
I
emergency
agree.
or no emergency.
So when can we spend that money?
As long as the vaccines are available to all the market.
What are you looking at as availability? This is the
Let's
problem.
stop for a break.
Or all the 4 areas, ways of acquiring vaccines, which I would mention, government is pursuing each all of them individually.
Okay.
Whoever comes first, we get vaccines.
Moses, let me stop for a break and I'll come back to you and then Lydia. And we'll start with that very comment you made.